Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing the medication known as Vigabatrin. Its brand name is Sabril. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Vigabatrin. We'll then touch on an example of dosing and finish it off with side effects with percentages. I've put together some slides to go over this information. Let's jump right into it. So the first thing to discuss here would be the mechanism of action or how this medication works. So Vigabatrin's anti-seizure properties are thought to be primarily the result of its action as an irreversible inhibitor of GABA-T. GABA-T is the enzyme responsible for the metabolism of the inhibitory neurotransmitter GABA. This causes increased levels of GABA in the central nervous system. In terms of indications or reasons we would prescribe this medication to a patient, well, we would often see this medication used as an adjunct in refractory complex partial epileptic seizures, as well as in the treatment of infantile spasm. With respect to contraindications or reasons we would not be able to prescribe Vigabatrin, well, we wouldn't give this medication to a patient who had a hypersensitivity to Vigabatrin or to any other component of the formulation. Now for an example of dosing with Vigabatrin. So in the treatment of a complex partial seizure, we may see an initial dose of 500 milligrams orally twice daily. The patient would then increase the total daily dose in 500 milligrams per day increments at weekly intervals to a dose of 15 milligrams twice daily. The maximum dose would be 3,000 milligrams per day. We would withdraw therapy after 3 months if there is no benefit. As with all medications, there are some side effects or adverse reactions that patients may experience while using Vigabatrin, so we'll go over some of those here now. 6 to 47% may experience weight gain, and 10% of patients may experience arthralgia or joint pain. Confusion may happen in 4% of patients, and 7% of patients may experience a coordination problem. Memory impairment may happen 7% of the time, and somnolence may happen 6 to 45% of the time. 4 to 15% of patients may experience a tremor, and blurred vision may occur at a rate of 2% to 13%. Aggressive behavior happens 6% of the time, and bronchitis 30% of the time. More serious side effects may include liver failure, visual field defects, or suicidal thoughts. Alright everybody, that's all we're going to talk about today with Vigabatrin or Sabril. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. So for today, take care.